Hello, and thank you for joining our first Hot Topics in Healthcare webinar. Today's hot topic is artificial intelligence and how it's being used in healthcare. I'm Dr. Keith Wilson, Chief Medical Executive for Southern California and Nevada, and it's my pleasure to introduce you and host this evening's or this afternoon's meeting with Dr. William Lopez and Dr. Jeffrey Klein. This session is being recorded for on-demand viewing. Feel free to share the link with your colleagues. We'll have time after for a 30-minute session to take your questions. Please place them in the chat as they come to you, and we'll address them at the end. Now, it's my pleasure to introduce the man with all the right stuff, Dr. William Lopez. Dr. Lopez is the National Medical Director for Virtual Care, AI, and Machine Learning at Evernorth. He is the leader of Evernorth and Cigna Healthcare's national virtual care strategy and is involved in coverage policy development, reimbursement, government affair issues, and assessing new technologies coming to market, in addition to many more responsibilities. Prior to joining Cigna in 2006, Dr. Lopez was a staff psychiatrist and medical director for psychiatric services at Snowden at Fredericksburg, a private behavioral health center in Virginia. He was a captain in the United States Air Force, where he practiced aerospace medicine, and as a veteran of Operations Desert Shield and Desert Storm, he is passionate about supporting and leading veteran-related initiatives, and I'd like to welcome the man with all the right stuff, Dr. Lopez.
Well, Dr. Wilson, thank you so much for this such a kind introduction. Very excited to be here today, and a great opportunity to talk about a very hot topic now in healthcare, AI, machine learning. If we're going to have a lot to cover, and I'll go over the agenda. So I just want to, put this in perspective. And I want you to think about this. We are living now in the future that we thought the dream of as children. And many of you may remember this if you were Star Trek fans, like, for example, hey, Scotty, we need more power. Captain Kirk, she's giving you all she got. And now we have the iPhone since 2008. This is a time that is just ripe for innovation. Since the onset of the pandemic, we have had an exponential growth on telehealth technology that actually surpasses the prior 5 years to the pandemic. These innovations have been driven by multiple factors, but among them is we're in the era of big data, big computing, and actually a lot of venture capital investment from the prior sector. Now, the way we see these different factors affecting us is with the development of more precise predictive models, and also the application of artificial intelligence solutions in different areas of healthcare. As I said before, we have a lot to cover today. We're going to talk briefly, get some foundation on some definitions related to AI and machine learning. The very hot topic of Gen AI, we're going to talk about that in more detail because it's going to be very impactful in the coming future. We're going to touch on model governance and the importance of having some governance system in place as you embrace AI, machine learning. We want to know how are providers responding to this expansion of technology? What is their sentiment related to all this happening around them? And then we'll get into current and future applications of AI. And at the end, we'll touch on some of the barriers that we're encountering. So again, a lot to go through. But first, let me just start with a kind of high-level overview of the Cigna Group. Many of you may be familiar, but for those that are not, we rebranded last year. We're now the Cigna Group. And there's two main arms. We have the traditional health plan, the Cigna Healthcare Plan, which covers commercial, government, and international health. And then, as you can see in the next slide, the Evernorth arm of the Cigna Group, which is the health services arm and works on developing new solutions for the challenges that we're facing nowadays in healthcare. Now, let's set the stage with some basic definitions. For many of you, this may be you may know all this information right now, but for example, as we move on to the next slide, we have the umbrella term of artificial intelligence. That's kind of the general term that refers about systems that try to simulate human thinking, human processing and activities. And you can see this in some of the natural language processing models, some imaging models, decision making and planning. Then you have Gen AI, which is been around since the end of 2022, early 2023, and focus on generating new data, new information based on a training set, and it's really revolutionizing our environment. You have discriminative AI, which is more about classifying and cataloging data based on characteristics or attributes. And we have the machine learning, which is the traditional predictive models that we are more accustomed to. And they're programmed to be able to learn from the data and to actually improve based on their performance. And then we have the large language models that you may be more familiar with, chatbots that are able to interact with humans and respond to queries or questions that they may have to get any information. It could be healthcare, could be something completely different. So that's kind of a foundation for us to move forward and now talk about specifically about Gen AI or generative AI. And again, as I mentioned, this is very new. This is probably the end of 2022, but when we first started hearing about it, and then in 2023, it was more evident that this was a game changer for many, including healthcare sector. And again, kind of similar to the prior slides, it goes through the big umbrella of artificial intelligence and the machine learning. And then when we get down to generative AI, these are more convoluted, deep neural networks that are able to generate output, create data, create source information. And many of you may be familiar seeing the press some of the challenges, like for example, that colleges have now with students utilizing these kind of solutions to produce theses or homework or different assignments, to the point now, ironically, that some schools are having to get specific AI solutions to discern what reports are made by a Gen AI model or ones are made by humans. So as we move on, you'll see that we can have a lot of issues with adoption, but let's put it in perspective. If you think the last century and more than a century ago, when electricity was first introduced, took 46 years before we had 26%, 25% adoption of electricity across the United States. With the internet, took about 6 years to actually have sufficient adoption to make it sustainable. With Gen AI, took about 6 months, and we have widespread adoption now. And it's not just so easy; it's just that it's so affordable. I mean, anyone can access this data. You can just download an app. You can download ChatGPT or Pi or some of the other solutions out, and you have it at your finger touch. So, and how we see this in different areas. Text creation, like the example I mentioned relating to college students, imaging development, video. It's going to get to the point that some of these solutions are able to simulate an individual. So you're going to have to start thinking about how are we going to be able to secure our own information, our video, our voice, and such. So it's very advanced. I mean, I think that we talk about it, it's like an arms race to develop the next ChatGPT 4 or ChatGPT 5. So it's really very fast developing environment right now. But it's going to have, in some ways, a very positive impact in many ways, including healthcare. And there's 3 main areas where we can see significant impact of AI, machine learning, and generative AI. making things work better for us, faster, and make the cost of different administrative tasks go down and improve the quality of output of the things that we're creating. Expanding our value process proposition, changing current models that we have now in place to make it more affordable and change completely how we operate and provide services to our customers, and creating completely new lines of service or products that are going to disrupt the market in healthcare and other areas. And I will be touching on those toward the end of the presentation with some of the not too distant future solutions that are coming into market and how are they going to change the way medicine is practiced and healthcare is delivered. With all these changes, it's very important that we have a way to manage these technologies, that we have a governance process that is responsible and that reacts or anticipate many of the regulatory challenges that we're going to face. And I'm going to give you some examples from that. Here you have the model governance model that we follow at Cigna as an example of how a payer is looking at this. And first of all, you need to have a charter. You need to have a group of individuals that are responsible to monitor and guide this. You have to have a sponsor, someone a leader in the organization that is championing this for you. You have to be cross-functional. You cannot have multiple silos and people doing different things that you have no awareness or visibility of across the organizations. You have to have in place clear policies and protocols, and also communication. Another part of this is testing. You have to test for bias, test for reliability, and some other areas that may impact these models, and have to be vetted and approved to make sure that conform to certain guardrails or guidelines that you have had in place. Of course, you have to do risk management. If you think about a national payer like the Cigna Group, we have solutions. We have over 3,000 models that are used for both clinical and non-clinical functions. And you have to make sure that they follow specific guidelines and that they are not impacted by bias, and that you have a sense of what the risk levels are. Like, for example, clinical models that are used for predicting customers at high risk have a higher risk because they involve PHI information that we need to better protect, be more mindful of protecting. And finally, you need some documentation. You need to keep track of all the activities of the governance board and have reporting available for regulatory agencies. And you want to do this in a way that aligns with the current regulatory agencies like NIST and some other agencies, so you're prepared for any changes or any requirements that may come up. As you're going to see next, this is actually just to give you perspective. These are the principles that Cigna is following as we look at different models for governance models. This is publicly available on our Cigna website, so you can just have access to the information. You can go to our Cigna page. But the areas that we look at include validity and reliability, how these systems are accurate, adaptable, and take into account possible impacts on our customers. Of course, safety, protecting PHI, privacy, fairness, looking at bias and other issues that may impact health disparities. Transparency, which relates to explainability and interpretability of the systems. And this is an area that we have a lot of controversy about what is in the black box. Not everybody understands how the systems work, and how can you make your best effort to demonstrate how the systems are able to come to the outcomes of the data that they produce. And then accountability. And like, we have to have human oversight. The way to think about it and the way we look at this at this point, especially with Gen AI, we always have to have the human in the loop. And we always also have to review your data. Don't At this point, you need to have someone looking at the data, make sure that it makes sense, and that is the outcome of the result that you were expecting. And why do we do all this work? Because oversight. There was a lot of activity last year at a federal level relating to AI regulation. The last one in October of last year was President Biden's executive order establishing new standards across the government for rules to manage artificial intelligence, and we're gonna see more of that. It's gonna, actually, there's a lot of legislation on the dock this year for more regulations and oversight, and also at the state level, you have to have uh, be mindful of all the changes at state level. We have seen proposed and approved legislation related to consumer privacy protection, AI itself, and also prior authorization and how AI is used in the process of prior authorization. And going back to the governance model, as you put a team together, you need to have all the stakeholders involved. You have to have legal, compliance, clinical, and data scientists to make sure that you have a good picture and an overall view of what the organization is doing and what the regulatory requirements may be to be compliant at any time. And I think that we have to do this because what is the option? The option is that the government is going to come and tell us what to do. So we need to be proactive and show that we're responsible and we're taking steps to secure data and to use AI machine learning in a responsible way. Most recently, if last week actually, the HIMSS meeting, there was a group of healthcare leaders that came together to create what is called a STRAIN, the Trustworthy and Responsible AI Network, which aims to create some principles for responsible use of AI. And the group included names like Microsoft of enabling the technology, but also the Cleveland Clinic, Duke Health, John Hopkins, and others. So we need to be proactive to make sure that we are staying on top and ahead of regulation and do it in a responsible way. So, how are physicians feeling about this? Well, there's a mixed bag here. And if we can see here, this is from the AMA physician survey on AI that they conducted last year. And as you can see, there's a lot of ambivalence, almost equally divided, mostly concerned providers, mostly excited providers, and there's a group, of course, that they have kind of in the middle. There's some excitement about AI, but also still have some concerns. So there's still a lot of ambivalence and concerns about it. And from their perspective, what are the biggest areas of opportunity? What I hear from providers is just addressing administrative burden. And this goes to the point that we hear a lot about physician and provider burnout. How can AI, machine learning, help improve efficiencies and decrease the burden on our providers that are overtasked and overburdened? And also, there's also augmenting physician capabilities, helping with scheduling, assisting with triage, diagnosing, and other areas like that. And next, how much do they want to understand systems? This question goes to how much information they need about the system they're using. And at large, I mean, like 3/4 of the respondents want to know what they're working with. They want to know about the features an AI solution may have, any possible bias, have some other issues relating to how it's going to impact outcomes and such. So there's a lot of interest in how these systems work from the physician provider perspective. Now we'll jump into how it's been used now and how we'll potential uses for the future. And there's different ways to look at this. So this is one perspective. What are the potential capabilities that we can leverage from AI and machine learning? And I know it's a busy slide, so I'm not going to go over every single one. But for example, let's look at translation services. If you have a system that can take a dictation from a provider about an MRI and relate to a patient with breast cancer, an AI system potentially could digest that information, actually go run it through against the BI-RADS criteria for cancer and give you a plain language document that is readable by a patient so they understand it. So that's one of the areas where we can see potential utilization. So again, these are potential areas where we can really leverage AI, also like summarizing documents, predicting, suggesting, diagnosis, and such. Now we look at the next slide, is more based on specialties. Where are these solutions used, and what is the future use for some of these solutions? And again, we have like 3 slides that have a lot of information. This data also comes from the AMA physician survey on AI, so you can reference to that to get this information yourself. And I will just pick a couple examples here. Actually, we can go to the next slide. I'll use the family practice example. Like if you have like current use, super patient engagement education through AI-driven chatbots. So kind of one of the solutions that we talked about during the definitions. And what could be done in the future? You can have AI solution that can enhance remote patient monitoring to make it more accurate and more timely in the way it reports data. So that's an opportunity and things that could be in the pipeline for the future. And there's opportunities in mostly all specialties. If we move forward, there are also uses in the non-clinical area where it goes into kind of improving functioning of the office, access into care, improving scheduling, having more support for providers, billing and revenue cycles, being able to create reports, coding, working with operations to help maximize efficiencies in different areas. Again, regulatory and compliance. A lot of the system can help us create reports that will assure that we are complying with different requirements from federal, state, and other regulatory agencies. Doing surveys for assessing patients' experience and satisfaction, education for patients, and even research. And actually, I was just recently on a call with a vendor who one of their tools help enhance clinical trials. So they can use this for clinical trials, which is a good segue to the next slide. This is not just healthcare delivery or administrative functions, but some of the areas that really impact healthcare, like in pharma and biotech. Can you imagine how many drug companies have all these drugs that they have tested for decades and they didn't have any solution or any use at the time? They're pulling all those out now to run it through these AI solutions to see if there are potential uses for other conditions. So they are using it for early drug identification, virtual screening, which is what I was just talking about, how to screen all these drugs to see if they have potential uses for other conditions. It is something that is being expanding exponentially. Manufacturing processes to decrease costs and improve efficiency in manufacture of drugs. Modeling molecules and other biological agents, predicting how a medication is going to react before you have to test it in humans, creating molecules out of de novo from just taking the characteristics you want for, like, let's say, a hypertensive medication, what receptors are they going to impact, the shape of that receptor, and how can you create a molecule that only impact that receptor without affecting others and creating side effects. And even optimizing clinical trials, better screening patients before a trial, which eventually could help requiring less patients per trial to get a reliable outcome. So you're going to see more and more of these coming down the pipeline in all aspects of healthcare. Now we think about uh, how is this going to translate into savings and how it's going to help with the challenges of the cost of healthcare as we apply these solutions in all these different areas that you see here. Is going to help us decrease cost and help improve the quality of care of our customers. And again, we touch on some of these areas, but from administrative services to drug discovery, you're going to see the impact of AI, machine learning, and Gen AI all across the spectrum of healthcare delivery and administration. Now I want to jump into an area that I really get excited is the more distant future, which could be just a couple years away. We don't know. But these are solutions that are coming down the pipeline that are really exciting. For example, stress wave test is a solution that actually we partner with Ellipsis on this solution, and it's used to measure stress level in a conversation. If a care manager is talking to a customer, they can get a sense of what their stress level is, and it may help guide the next step for that customer. Like, do they need to be connected with a primary care provider? They need to see a specialist or a care manager. And actually, there are other solutions that have evolved and are in market now that actually can predict or diagnose cognitive deficits or mild cognitive deficit and depression just with a 2-minute voice sampling. So can you imagine you having that as a screen tool for a primary care provider where they can tell the patient, hey, why don't you tell me how you're feeling today? And it could be any sentence. They don't have to read as text or anything. Just talking for 2 minutes, and they can have a screening on a patient. The next one is from my perspective, mind blowing. So we're all very familiar with wearables. You know, I have my Apple Watch here. You have your Fitbit, whatever. We're talking about invisibles. These are devices that don't even have to connect to the human to provide vital signs or biometric information. What this lady is holding here is not a piece of foam, but it's a Wi-Fi router or modem that it will be installed in someone's home. It could be my parents or someone that we need to monitor. And through using an AI algorithm, it will measure or analyze radio frequencies from the Wi-Fi device. And actually, it can provide pulse, respiratory rate. It can provide outcomes from a polysomnogram with 95% accuracy, measuring different stages of sleep. So in the next slide, you can see another example of their use. This comes from, actually, I should have mentioned, it comes from MIT. It's called the Evernorth box, and you can probably Google the name and get more information online. This is an example where an individual is using an inhaler. The device can track the movement of the individual to the house, can track picking up the inhaler, shaking it, and inhaling and measure the expansion of the chest. So for medication compliance will be one other use case that you can apply this for. So again, it's being tested, it's out there. It's not widely used, but it's something that we're gonna see more and more. The next one is another solution that is very interesting. What about getting all your vital signs using your iPhone on your smartphone? Like there's a number of solutions like this out, but this one here is called Mindset. They can get all your vital signs through your iPhone. The way they do it is through temperature differentials in your face, and they're very accurate. I saw a demo from them. Their training set includes people on their fluorescent light, incandescent light, natural light, makeup, no makeup, all skin colors. So they have a very robust training set and very accurate. So this is something that a primary care provider could use on a telehealth session. And I think it's probably used already in some settings. And then to get a little more esoteric, as we come to the end of the presentation today, this also comes from MIT, is the cell rover. They have created an antenna that can go inside a cell and monitor different cellular functions. So this, can you only imagine the applications for this in the future to manage different conditions and monitor, respond to medication. So great potential here for more discovery innovation. Now, my last slide, we're going to move to the barriers, and I'll go briefly in this so we have enough time for Q&A. Well, there's some model governance challenges. We talked about this before. There's many silos that exist with the organizations. You have to make sure you have a comprehensive team that you work with, making sure that you meet regulatory requirements, which are also increasing exponentially. And we're getting a lot of federal and government agencies, state agencies, issuing different ordinances or rules to monitor the way that we are utilizing AI. Hiring people. Do we have enough data scientists to support different projects within your organization? We need to hire all these people because we're not, many organizations are not prepared for this, and they were not thinking about it. Now they have to rush to do this. And again, breaking down silos, especially in a large organization, you can have different teams working in the same project or something similar, and they don't know that each other is doing it. So you need to have a way to break those silos, and documentation and streamline electronic records. So I will stop at that. I know I covered a lot of information. The video is going to be available online, so you can go back and see it. And with that, I'll end. I'm going to turn it over to Dr. Klein for the Q&A.
Thank you, Dr. Lopez. We've got a lot of questions coming in. I will whip through them and send them off to you as quick as I can. First one is, are there any unbiased third-party organizations that verify that the AI models are unbiased and what the risk tiering is?
Yeah, well, I'm not aware of any non-for-profit organizations that do that. I think that we have to be responsible for the data we produce. And remember, the data you get is as good as the data you put in. So first of all, you need to make sure that you're using validated data that is annotated and that you already have scrubbed it, if you want to put it that way. But I will look into that. I'm not aware of any organization that specifically help with that. It's usually done in-house.
And the other one, it was on one of the slides, but you kind of went through it quickly. Can you share a little bit more about how AI will improve diagnostic accuracy? It was on the slide a little bit about dermatology and radiology, but yes, if you could go in a little bit more detail on that.
Yeah, like one example, and the classic example is radiology. I mean, nowadays, especially for breast cancer, AI models that go over radiologic results are more, even as accurate, more accurate that a human can do. And it's because the large amounts of data, I mean, there's hundreds of thousands, millions of samples, and systems, AI systems are able to look at subtle differences beyond of what our eyes or brain can capture. So the larger the model, the more data you put in, especially in healthcare, the more accurate they can become. So that's how usually I look at it. And I think that, it's interesting, and I'm going to digress here a little bit. Now there's a lot of concerns about liability using an AI model. I believe that at some point the liability will be not to use it. Like Dr. Klein, you had the opportunity to use this model to diagnose this condition. You didn't. Why you didn't do that? And you may be liable for that. So anyway, it's kind of a dynamic environment right now.
And I know that's certainly the case in radiology, right? And we've been using computer-aided mammography for a while, and that continues to iterate in terms of how we use that. An interesting question that's very broad. But when you look at the benefits, saving in terms of per member per month, catching disease upstream earlier, retarding disease states, reducing hospitalizations, do you have an idea of where we think the biggest savings might be? It's kind of using your crystal ball, but where do you think our biggest savings might be, maybe in the near term or the long term?
Well, I think that we have to look at the larger, the more chronic conditions like diabetes, hypertension. If we can get to a point where we can predict patients at a higher risk, we do it now, but with more accuracy, that can end developing diabetes or having complications for hypertension, that eventually will help us drive down total cost of care. So I think that that's one of the areas where I see opportunity, more in chronic disease management.
Great, I appreciate that.
And prevention.
And how is AI used in claim approval, pre-certification, and in that case, what sort of fail-safes are used to be able to protect patients?
Yeah. So let me tell you, and I'll talk from the Cigna experience. AI systems do not make determinations. What they do for us, they help us gather information and summarize it. On claims, peer review activities, and ultimately our medical directors are the one who make the determination. We may have some solution that summarize everything for us, but at the end of the day, we don't use it for the actual determination. So I think, and again, that's how we leverage. We use it for organizing data and processing claims, and again, keep the human in the loop and reviewing the output of the solution. We always have to review what the output is.
Great, I thank you for that. And how is AI used in reading biometric screening, allowing providers the ability to seek care more proactively, looking at that sort of thing? That kind of fits into the chronic care that you're talking about.
Yeah. So, well, there are different ways to look at that. You can look at a population level. If you have a panel of patients that you're following, and an AI system could help you identify which customers are showing higher blood pressure readings, or who you need to maybe reach out for a call because their hemoglobin A1C was too high or went up from 5.7 to 7. And so AI system can help go through a lot of data in a lot of less time and help you identify those that you need to reach out on a timely manner.
Okay, and let's see, I'm trying to, there was a question regarding, and I'm thinking, can you talk a little bit about how the AI hallucination answers that we sometimes read about, how that kind of fits into what we look at and how we actually determine what real answers are and what are not real answers?
Well, as a psychiatrist, I would use the word confabulation, which is they're coming up with a solution from nowhere. And, you have to think about the nature of the system. They're programmed to please you, to provide you with an answer. So we have had a number of situations where they come up with an answer that is not real. And again, this goes back to you have to have a human in the loop and validating your data. But also it's common sense. If you query something and it just doesn't sound right, just go back and validate the information. Find another source. At the end of the day, this comes to the point of trust. How much you trust the systems, and we have been accustomed or trusting some other systems. Like, for example, if you do a Google search, you just put your query and you just trust that they're going to give you the right answer. And sometimes we translate that thinking to AI solutions, and we have to be very mindful, very careful that there may be situations where the system may provide you erroneous output.
And there was a question regarding false positives, false negatives, cost. How do we use that in how we use AI in our solutions or in solutions in general?
Yeah, I'm trying to see if I can answer that question. I'm not sure I've understood it.
Yeah, I think the way I see that is, and I'm going to take a stab at an answer there, is we use those in how we make any determination, right? And how we look at any results in healthcare, right? There's nothing is 100% perfect. As you said, Dr. Lopez, the information in helps determine whatever information is coming out. If there's a test result, there's often an amount of false positives or false negatives. Hopefully, computer-generated models will shrink those false negatives and false positives depending on how much good information we have going in that will decrease our errors, right?
Yeah, I get it.
That's the goal of this.
Yeah. So Jeff, you're right. I mean, systems, humans, they're going to have some mistakes, false positive or negative. The main difference is that as you put more data in the system, as the sample or the number of the N is larger, you're going to shrink that false positive or negative results. So there's a different where if you think of humans, they're more static. This is the knowledge I have, this is what I know, this is what I see. And no matter how many I see, there's not as much potential to lower the threshold.
Yeah. So those are all the questions we had in the chat. I will hand it over back to Dr. Wilson.
All right. Thanks, everyone, for your time and questions. Please take a moment to complete the survey that will populate after the session. Thank you, Deborah DiMichele, for putting this all together.
Yes.
Thank you, Dr. Lopez, for that great discussion, and Dr. Klein for orchestrating that question and answer session. We appreciate your interest and can encourage you to reach out for more information. Stay healthy and have a great day. Thank you.
Thank you all.